Welcome to the Gaylord Area Chamber of Commerce State of the Community Breakfast. This is one of our favorite events to put on. It gives us an opportunity to, showcase what's happening in Gaylord and what's going to happen in the future. I'm Paul Gunderson. I'm the Executive Director of the Chamber, and I want to thank the staff for not making me walk up those steps. With that, I'm going to introduce the City Manager, Kim Aury, who is going to, give us 90 seconds of why we live in the greatest community of the world. Kim?
Good morning, everyone. Again, I'm Kim Aury, City Manager here in Gaylord. I'm just going to give a little bit of a presentation. I want to say, first of all, thanks to sponsors, to ITC, and to Blue Cross Blue Shield. Is there anyone from Blue Cross that wanted to say a few words? I don't know. I guess not. Okay. I've just got a couple of things to talk about, or actually one big thing that's going to affect all of us in the next 3 years. It's the DDI project. So MDOT is spending about $60 million on a new project. Everyone, I'm sure, has heard of it. Exit 282 is going to be redesigned, new bridges over for I-75 as well. So I'm going to give you kind of a little timeline of what to expect in the next 3 years. So in 2026, in the fall of 2026 or late summer, they're going to be doing some widening and some crossover connections for I-75. They're going to be removing the trees that are in the current intersection. They're going to be improving the detour routes of Milbacher and McCoy roads, and they're going to be replacing some storm sewer outlets, so that will affect Mankowski Road. So not a whole lot, just getting ready for the main construction next year. In 2027 is when the big construction starts. They're going to do a new signal at South Town Line and M32. They're going to start construction on the north side bridge with the bridge rebuild and the pavement reconstruction. And then on M32 between West Street and Wisconsin, that will be done, a complete reconstruction. Underneath that will be city utilities done as well. And there's going to be a sidewalk construction from South Town Line to Meacher Road, and then also from Maple to Little League Drive. So basically we're going to have sidewalks from Little League Drive out to South Town Line on both sides of the road. So it's going to be a great addition to our community. And then there'll be a mill and resurface of M32 from Murder Road to Meacher. So then in 28, we're going to have the South Bridge pavement reconstruction and the rebuilding of the South Bridge. And then the main reconstruction from Meacher to West Street with the DDI will happen in 2028. There will also be an addition of a carpool lot off of Dickerson Road. And then they'll be removing all of the temporary pavement that they have constructed in 28. So in 29, all they have to do is landscaping. So one of the big things, one of the big concerns for everyone is that obviously traversing from the east to the west side of town is going to be difficult, but MDOT is going to maintain one lane of traffic in each direction and also have left turn lanes available at the lights as they are now. There will be a full shutdown of M32 when they're doing things to the bridges, when they're demoing the old bridges, and when they're setting the new bridges in place. There'll be some full shutdowns of M32 at that time, but they'll limit it as much as possible. So I think we have a slide that kind of shows what the DDI is looking like. Oh, it's behind me, I can't see it. So that's what it's going to look like when it's completed. It's going to be a 3-year process. It's going to be a kind of a pain for everyone, but we are looking forward to having it done, and the flow of traffic will be awesome at that point. So I'm handing it off to.
Thank you. Well, good morning. Thank you again for coming to the State of the Community. My name is Brian Gerstenberger, and I'm on the Chamber Board. And with me today, we're going to be talking with Heather Appold from the Kirkland Community College and Brian Pearson, who's going to talk a little bit about the Otsego Career Access Network. So let's start with you, Heather. Tell us about the Executive Director role at Kirkland Community College Gaylord and what it means for our community.
Thank you for having me. Is this on? Yeah. Okay. So the Executive Director role is all about relationships. It was created out of a restructure And we really want the community to understand what is happening at Kirtland and that Kirtland Gaylord has been here for many years. We've actually been an educational pillar here for 24 years. And I think it would be safe to say many probably don't even realize what's in that building over by the high school. So that's part of what I'm doing, relationship building, educating and fostering relationships and letting people know what we have to offer within our building. We have lots of experts in the field, faculty, staff who are very passionate about what they do, good at their trades and teaching the students. And we want people to realize these students are getting a great education and that impacts our community through jobs, through steady employment, through industry. So in addition to the educational programs, we also have business rooms that businesses can rent, and then we have a testing center too for professional testing. So community engagement is part of this role. Engaging our students is our #1 priority, and then businesses and community members, so we know, so everyone can know what's happening there.
Awesome. I would say not a lot of people know what's going on at the.
Give us a call, come see us, tour, and see what's happening inside that building and what it means to our community.
Awesome. Okay, so as the school year is now started and kind of halfway through that first semester, what are some things that are happening at the Gaylord site, and what is on the horizon for Kirtland Gaylord?
So we started the school year with 139 students in 9 different classes. Primarily trades happens at the Gaylord site. Electrical, HVAC, and refrigeration, welding and fabrication, and some other trades happen. Plus we have speech and English that happen nightly to foster those students. Currently, at the Gaylord site, 63% of our students are 24 years or younger, so a younger generation there. And we have 92% of our students here in Gaylord are male, and that kind of goes along with the trades that we offer there. So in comparison, overall at the entire college, 40% are male and 60 are female. So male dominating up here because of the trades. So we need to get more ladies interested in those trades programs to even those numbers out up here. But skilled trades are growing and we're excited to be a part of it. Things that continue are our welding classes for the high schoolers. We have dual enrollment that happens there. We've always had an advisor on campus, but new this year we have a counselor that comes a couple days a week and a success coach to help meet the students' needs. We want to meet the students where they are, remove any barriers they may have that could stop their education. Think basic needs, that's become a really big thing, helping with gas cards, food cards, things like that, so they can focus on their studies. That's what's happening now in the horizon. To wrap things up, I think the horizon is very bright for Kirtland Gaylord. We're strengthening relationships with our local high schools. I had some meetings with them to see how we can enroll, dual enrollment numbers up. We're a member of the OPAN to help move the needle on post-graduation education, so that's a great partnership we're excited about. We're exploring new programs. We've had some meetings with healthcare and some other industry and employers to see what's needed in our communities and how we can help foster that. And then we're looking at launching some community education programs. We want to get the community in there, so think things like CPR, yoga, wreath making was discussed, things like that. So if anybody has any ideas, we're open to that. So really, community's in our name. We're a community college. We want to be there for the community, partnerships, sponsorships, and get people in there to educate our students too. So. Well,
that's great. I can't wait to see what Kirtland Gaylord is going to do here in the near future. All right, let's turn it over to Brian Pearson. Brian, you are going to talk a little bit about the Otsego Career Access Network, or OCAN. So what is OCAN and what are the goals?
Yes, OCAN stands for Otsego Career Access Network. So we picked career intentionally. It's what's called an LCAN, or Local College Access Network. There's 15 of those across the state of Michigan. We're fortunate enough and thankful to the Community Foundation, who had the foresight about 5 years ago to say Otsego County can benefit from this organization. So it sits under a bigger umbrella called the Michigan College Access Network, but we chose career intentionally because a lot of times people think about college and they think about it's a 4-year degree, which are great.
Yeah.
But we understand, our definition of that is any transferable degree or certificate that may be, very thankful to Kirtland for the programs they offer, because those fit our definitions. And what happens to a community when that attainment level starts to rise is crime starts to go down. I see, those people here. I saw Chief Place here in healthcare. the life expectancy goes up and the frequent visits to the emergency room go down, and volunteering goes up in the community. So we saw a real benefit in the Community Foundation did to establish an OCAN here in Otsego County. So we're built on a collective impact model. We have roughly 20 people that sit on our leadership team from K-12, higher education, business, government, and many of those individuals are sitting in the crowd and on stage with me today, so we're very thankful for them.
Awesome, awesome. So how are you reaching your goals?
So our primary goal, our overarching goal is called 50 by 30. Our goal is 50% of Otsego County has some type of transferable degree or certificate by 2030. When we started this initiative, we were at 33%. We're now up to 39%. Now we have a ways to go, but we're trending in the right direction. So underneath that, we have 3 supporting goals. The first goal is enrollment in higher ed within 12 months after graduation. The second goal is attainment. So when those students get into higher ed, we can support them and they actually graduate with a degree. They don't just graduate with that. And the third goal has to do with bringing programs to that 24 to 65 or 25 to 64-year-old population, the working population. So we have a few initiatives that we have in place. A lot of it has to do around building a system in collective impact and connecting those entities that are involved in that mission. But also we have a few programs, and one of them I'll highlight is we have a summer melt prevention program. I'll say this, in all our programming, we do have a focus on economically disadvantaged students. We serve all students, but certainly our focus is on that population. So we have a real successful summer melt program that helps students that say they want to enter college when they graduate, but something happens over the summer and they don't actually make it. So we provide support for those students over the summer. This year, almost 70% of our students that were in our summer melt prevention program actually ended up on campus. And so, thankful to our partners, Kirkland being one of those that help us with that program and help support those students. And that's making a difference if we can get them there and then make sure they attain their degree at the end of this bag. So that's kind of what we're about in a nutshell.
Well, that's great, and I just wanted to say thank you guys for making such a huge impact in our community, and we appreciate it very much. So right now I'm going to turn it over to Ashley, and she is going to take it from here.
Good morning, everyone. Thank you so much for being with us. I'm Ashley with the Gaylord Area Chamber of Commerce, and I get the opportunity this morning to talk about a population that we don't frequently discuss. And through conversations with Donna, I've realized we don't have this discussion until we need this discussion. So I am joined this morning with Donna Wishart with the Otsego County Commission on Aging. And we want to chat a little bit, Donna, about what your organization is and what you offer to the community, because per our conversation, as we talked, a lot of people don't address the Commission on Aging or even start that conversation until they're in a position where they really need it. So what does aging mean to you, and what unique opportunities and challenges do older adults face as our rural population continues to age?
Well, thank you, Ashley. It is an interesting question, especially because we usually don't like to talk about aging. And actually, it's a great question for the audience. What does aging mean to you? I will leave you to ponder that for a while. Before I get to the heart of the answer to what aging means to me, Ashley, I would like to point out that aging often falls into categories, whether that's funding categories, programmatic categories, silos of funding, and also it often reeks of ageism. For instance, an age category for eligibility for services is often established. For operations, that might be helpful, but for individuals, it is not necessarily serving their unique needs. For me, I think of aging as a journey of life from birth, filled with adventures. We might be well to think about aging that way and even consider a SWOT analysis across our journey of life, celebrating our strengths working to overcome our weaknesses, keeping a watchful eye on quality of life opportunities, and managing risks that always come our way. The unique opportunities that you ask about and challenges that older adults face in our rural population as they age include community-based limitations for affordable housing, shortages of physicians, and most especially those that are trained, certified, and skilled in geriatric medicine. In the home care industry, we have a severe shortage of direct care workers. The challenges, again, will be funding challenges for service, availability for health care, accessibility for health care, which often points to transportation, and actually the sheer cost of health care may be exacerbated as the population ages. You know, aging is an interesting topic even though we don't want to talk about it. And many people, unfortunately, do not plan well for their own aging. Consider this. Remember when you were 12 and you wished you were 16? And when you were 16, you wished you were 21? And when you were 21, you wished you were done with college. And then you thought, well, I'll get to 30 and it will be perfect. And then somewhere along the line of the journey of aging, for some of us at least, we wish we were younger again. I would like to share just 2 quotes from some famous scholars. C.S. Lewis would tell us about aging. You are never too old to set a goal or dream another dream. And actually, Albert Einstein cautions us, do not grow old, no matter how long you live. Never cease to stand like curious children before the great mystery into which we are born.
Donna, when we talk about the Commission on Aging, what are the key services that are offered, and where do the gaps remain in meeting those critical services in supporting our aging community and their caregivers?
Very good. There are actually 2 terms I would like to introduce as a foundation to this question. The first is called home and community-based care. The second is called person-centered care. With the Otsego County Commission on Aging having a mission of promoting independence and well-being for older adults and supporting family caregivers, we are providing services in homes and apartments all across this county, from county line to county line. That represents home and community-based care. Because we are here to help and care for people, and we're working with individuals, older adults, and family caregivers, individual needs are important and actually critical. Hence, we talk about person-centered care. It's a concept of addressing the individual needs of each unique person and each unique situation. And so, for the Commission on Aging, that calls for a diverse range of programs and services. We have nearly 40. I will mention a few of our key services that you ask about. Many of those are associated with the Older American Act of 1965 and include such things as nutrition and nutrition education through our meal program, in-home services such as homemaking assistance, personal care, and respite. And we also additionally become and provide advocacy for many older adults and family caregivers on topics of Medicare, Medicaid, Social Security, elder abuse, housing needs, and insurance concerns. We provide also healthy aging programs that are designed to influence good health and well-being for the body, the mind, and social well-being. We offer diverse exercise programs and diverse education programs. We also benefit from the help of 200 to 300 volunteers each year helping us. At the Otsego County Commission on Aging for older adults and family caregivers, we also offer support and education on such topics as Parkinson's disease, cancer, dementia, grief and losses, and grandparents raising grandchildren. For those in the audience that appreciate data points, I would like to share a little more information and speak to it this way. In the last 5 years, we have experienced a lot, all of us. In one way or another, we were impacted by the pandemic, the tornado, political angst, and the most recent historic ice storm. During that time, the Otsego County Commission on Aging did not fail and provided 211,525 home-delivered meals, 51,622 in-home service units, 42,289 congregate meals, 39,145 advocacy appointments, with 37,145 participant counts in our healthy aging programs and 1,098 participant counts in our education and support groups. So we might say we have survived to live another day. The gaps in service, Ashley, that you ask about are best filled through collaboration and partnership across the community, especially with the importance of mental health counseling, affordable housing, legal assistance, and transportation.
Those statistics are staggering, and it really does attest to the commitment and involvement that Commissioner Lynch has in our community. But those unseen. Another aspect of the organization that goes unseen is people may not realize you are a local, small nonprofit, small business in our community who also needs to thrive and do well to service our community. What are the challenges that you are facing in the workforce, doing your budget, staffing shortages, and how are you overcoming those, and how can we as a community welcome support our aging population? How can we support you?
Well, absolutely. All of the things you mentioned are challenges every day and are of concern. So absolutely, they affect us. In fact, however, in today's world, if a nonprofit, a small nonprofit, is not functioning like a well-oiled small business, there will be failure for many reasons. How can the community help? The community can help by continuing to care through the provision of funding support, special donations, and legacy gifts. Equally important, however, individuals in the community and businesses at large can help us by joining our team, lending their expertise through volunteer efforts. I will leave you with two thoughts. The first, another quote: "To help and care for those who once cared for us is the highest honor." And secondly, I look forward to hearing from you with the answer to your question: what does aging mean to you?
Thank you, Donna, for being with us today. I am going to right now pass it over to Munson OMH. We have Rob Richardson here in the room. Munson OMH is one of our sponsors, and I would like to chat with them. But first, before we hear from them, let's pass it to Dennis. Dennis is going to talk with a representative from Munson and give us a little insight on what's happening in our healthcare.
Good morning, everybody. My name is Dennis Keck. I'm the Special Ed Director and Curriculum Director at Gaylord Community Schools. I have the honor this morning of talking with Katie Javetsky from Munson Healthcare at Otsego Memorial Hospital. How are you, Katie?
I'm good, thank you.
Nice
How are
to
you?
see ya. So, as we drive through town and drive past hospital, we've noticed a lot of construction. Looks like a big project. Can you share an update on that expansion and renovation project, including the ambulatory surgery center?
Yeah, absolutely. It's super exciting right now. If you haven't had a chance to drive by the hospital, you got to, because every day it literally changes. It's one of the most exciting parts of my day. I get to see it at the start and at the end. So with that construction and renovation project, really right now we're in the midst of a 2-year renovation project. And it's $33 million. So it's an incredible project. It's going to allow us the opportunity to expand our OB services, or our birthing center. So we're going to increase our labor, delivery, and postpartum rooms. There's also going to be a private C-section suite for those mothers, so that'll be amazing for them. And then we're going to increase our ICU services in isolation rooms, and then our medical surgical unit. So adding private rooms, bigger rooms, and really meeting the needs of those patients when they're sick and not feeling well, and their families. So, and then with the surgery center, that's an additional $15 million project that we've added to increase additional surgery services, and that's just across the street, right off of North Street.
That's exciting. I've said this a lot. I had all three of my children at Siegel Memorial, and that OB was just the best service. It was good memories from there. So similar to a lot of professions in our community, it's hard finding people at times. I know in school we struggle sometimes finding qualified teachers. I assume it's the same in healthcare. How are we progressing with recruitment to support our community, especially when it comes to adding more primary care providers?
Sure. So that's a big area of focus for us. So since October 2024, we have been able to add more providers. And I say providers because that's a term that we use that encompasses all healthcare providers. So physicians, nurse practitioners, and physician's assistants have all been added. And some of those areas of focus that were needed include internal medicine, family practice, general surgery, and urology. Urology has been a really big need, and really can be a struggle to recruit for. So we've been very blessed in that we've been able to develop and get those providers in, and then also emergency medicine. So that's an area that I'm passionate about, and that's really growing in our community, and the needs there. So we got to be able to get those providers in. And then those recruitment efforts are really focused on the needs of the community. So we really look at where is the need for the community and how do we make that need available for our patients. And so in doing that, it takes a lot of work with our recruitment team and making sure that we get the right fit with the right provider in the right community.
So staying with the emergency services, we've heard there's some pretty positive changes in the emergency department. Can you talk about what's being done to reduce wait times and improve patient flow?
Yes. So we definitely recognize that's where I'm the manager of, is the emergency department. And so that's a huge area of passion for me specifically. I know and recognize, and so does everybody else in our healthcare team, that when people come to the emergency room, they don't feel good. They're sick. Most people are very afraid. They don't understand what's going on. And so we really wanted to focus on how do we keep those people? How do we retain those people? Because a lot of times when people don't get treated right away or seen right away, as we say, they get frustrated and they leave. And that's not the kind of community support we want to provide. So for me and our team, we really looked at how do we retain those patients? And so some of the ways that we've looked at doing that is by changing our environment and changing how we have our staff set up. So in doing that, we've created a provider and triage process at different times of the day. And so what that means is when you're getting triaged by that triage nurse, you might see a physician in that room with you. So there might be a physician right there immediately, and we might actually start your workup even though you don't have a bed assigned because we're full, but we're able to still take care of you and get your treatment plan started. And in doing that, we've actually had a 60% reduction in those patients leaving, which is what we want. We want to capture our community members. We want people to feel like they can get health care with us and feel like their needs are being met and they're not leaving untreated and they're not leaving afraid.
Awesome. Well, the community certainly appreciates the advantages of having our own hospital service in town. It is a huge advantage for our small town, and we appreciate all the efforts that it seems like you're putting in to expand and recruit good people to our community. So thank you very much.
Yeah, you're welcome.
I'm going to hand it back over to Ashley.
And I'm going to pass it off to Kim Ari, our city manager again.
I'm going to do a couple of introductions. First of all, I've got Rob Richardson from OMH. Say a few words.
Thanks, Kim. Good morning, everyone. Thank you, Paul and the Chamber, and thanks, EFRE, for letting us be here today. What a great opportunity just to connect. We're really committed to the community, to providing world-class health care here in Gaylord and Otsego County. In fact, we're doubling and tripling down on the commitment Katie, great job representing all the investments that we're making. Here in the community itself and on the campus, we're investing about $50 million in new construction. You saw some of the pictures just now. And even up in Petoskey, another 17 million, almost, well, 65 million in total in northern Michigan invested by Munson. Promises made, promises kept. All of this started a couple of years ago with the plan to keep healthcare and grow healthcare in northern Michigan, right here in Gaylord. You look across the United States, rural healthcare and small communities are losing hospitals, but not us. We put together a plan that allows us to grow a regional hospital presence here in the community. So really exciting about that. And we're really trying to dig a little bit deeper and reestablish ourselves in a rooted way in the community. Starting in January, we'll begin our 75th year as at Siegel Memorial Hospital, so a huge celebration coming. Over the last year, reestablishing ourselves in the community, like at Alpenfest, back to the parade. I know it's a small thing, but it is a visual reminder that we're really committed to the community. We're also able to establish the first aid tent and staff and pay for RNs to be there. And I know they did provide some life-saving services while they were there, which is really exciting for us. We do have, now this is kind of fun, the Trunk or Treat event coming on Saturday. So stop by and bring your kids and get some candy. But just some ways for us to reestablish our presence in the community, continue to have that commitment to providing world-class health care for everybody here, continue to have not just new buildings, but fill those buildings with new young professionals, doctors and providers, just like Katie said, who can continue to perpetuate great health care here in the community. We are a not-for-profit. Some people forget that sometimes. So the investments that we make because it's the right thing to do. And I do want to thank those in the community, so many people even here in this room, who have supported us in our not-for-profit status as we make these investments. But in particular, the Vollmers, Gary and Kathy, the Johnson family, and the Poet family, all have been very active and very supportive of us. So thank you to them, and thank you to all of you.
Thanks, Rob. And we have one more sponsor, Consumers Energy. A few words from Carlin Smith.
Thank you, Kim. You guys, by the way, have an awesome city manager in Gaylord, so it's a pleasure to work with Kim on a regular basis. So I have a speechwriter, Rob, so sorry, hopefully you can work up to that someday. So on behalf of the entire Consumers Energy team, and as a proud Northern Michigan resident, it's an honor for me to be a part of the Gaylord Chamber State of the Community event today. It's been 6 months since Consumers Energy and our friends at our rural electric cooperatives got very acquainted with the electric infrastructure here in Northern Michigan. The 2025 ice storm was a catastrophic event that impacted all of us in this room, obviously, and I'm sure most of you are still dealing with the aftermath. It's amazing the resilience, the collaboration, the neighborliness, and the genuine hard work that all of us put into the storm response. The leaders and residents of Otsego County really stepped up. It was the most expensive storm in our company's history, and I'm proud to report that most of our customers who lost power were restored within about a week, a few stragglers after that. And we did that even as crews were rebuilding entire circuits that lay in ruins. It was, as we've said, it wasn't a repair, it was a rebuild. And it was quite an extensive project and really a remarkable achievement by our crews, as well as the crews at Great Lakes Energy, Presky Electric and Gas, and ITC, all of our friends that were working out there in the field as well. So leaders at our company are working to reduce the impact of future storms. Hopefully the ice storm was a once-in-a-century event, but storms will continue, and we're taking steps to trim trees away from power lines, invest in new equipment and technology, and help keep the lights on in this era of increased and more intense storm activity. This Reliability Roadmap program, we're calling it, is an investment in our power grid of nearly $9 billion over the next several years. We're proud of our investment, and we'll be continuing to work hard to keep your lights on. So thank you so much. It's an honor to be a part of this great community event. So do I go to Ashley? Or did you want to speak?
Thank you, Carlin.
All right, so I'm going to be talking with Carlin Smith. You heard a little bit about the ice storm there from Consumers Energy, and also Gavin from the Otsego County Emergency Management. And I think a lot of times we take for granted power until it's gone, right? Or we don't think about the emergency system that we have until there's an emergency, until you have to use it, right? So you talked a little bit about, Carlin, you talked a little bit about the ice storm. How significant was this storm, and how does a utility like Consumers Energy approach something of this scale?
Yeah, so as I mentioned in my sponsor remarks, it was our most expensive storm in our company's history. In fact, we used up our entire 2025 storm budget in one event. So we canceled all storms for the rest of the year.
That's good to know. That's good to know.
And we also used the largest network of resources, feet on the ground, to address the storm. And I equate it to like the mobilization of an army.
Yeah.
So you set up your headquarters. I don't even know what slides I provided. Oh, there you go. So, but we set up our headquarters, brought in our leadership team, mobilized troops. In fact, we mobilized crews even before the storm happened in anticipation based on the weather information that we had. So we were staged and ready. And in mobilizing those crews, then you got to house them, you got to feed them. I look at my friend Thomas at Great Lakes Energy. They created a whole city within the city of Gaylord to house their crews and things. So that's a remarkable logistics challenge. Then you have your scouts that go out in the field. We call them assessors that assess damage and kind of mobilize where we need to focus our efforts. And then, of course, the crews are out doing that. They're supported by forestry. And they're supported also by what I didn't even think of, mechanics. We saw some weary mechanics at our Boyne City Service Center one evening, and it didn't even occur to me that they're out keeping our equipment running and things that I like things that you don't even think about. And then on the internal side, I forgot to mention forestry crews and all of that go with it. Then on the internal side, we got our communications network and trying to keep the public informed best we can of what's going on. And my direct work with community leaders and emergency managers and all of that. So it's a big undertaking to take on this kind of event.
Yeah, and I think like you mentioned, there's a lot of things that we don't even think about, like gas. I mean, I can imagine how much gas you guys went through just going between, Gaylord and out to Joburg and things. I mean, just all over this area.
The dilemma of there was no gas to get up here, right?
Right.
Gas stations were closed, so we literally shipped gas up here, and then our emergency managers and our first responders, they need fuel. Well, can we have some of your fuel? Well, we kind of need it for our, you had that balance to strike. It was a lot of cooperation and collaboration went on.
Good. I want to talk a little bit about just going beyond just the physical work that had to happen. In what ways did Consumers Energy support the community during the storm? Just besides going out, but just helping the community in general.
Yeah, it's something I'm proud of our company about. We stepped in the tornado. We stepped up and did donations and food trucks and that kind of thing. And we did the same thing with the ice storm. I think it was Tuesday after the storm. There was still ice everywhere. We were able to find a food truck in East Jordan, and it came here to the Free Church and fed. I think we served about 400 meals that evening. We also shipped a lot of water and things up to the area. And then after the storm, we have a foundation at Consumers Energy, and the Consumers Energy Foundation made donations totaling $50,000 to disaster response funds. Otsego Community Foundation got $10,000 of that. There was $10,000 in Emmett County, and then $30,000 in multiple counties in Northeast Michigan. So, and I guess if you'll allow just a little elaboration, one of the things I think maybe understated, maybe not. Hopefully they're recognized the way they should be, but the Human Services Network here in Otsego County was remarkable. You talk about our crews being mobilized, you talk about emergency managers and the first responders and those crews being mobilized. The Human Services Network in Otsego County mobilized as well with the same precision and the same impressiveness as anybody else. And I'm thinking about the Otsego Community Foundation, Otsego County United Way, the 211 Network, E-Free Church, they were on top of it and really took care of the people in Otsego County in a way. You know, you kept them warm, you fed them, you got them water, you gave them the necessities, and it was a great thing to observe, very heartwarming.
Yeah, I would agree with that. With being here during that, just seeing all of the community come together, like the community organizations come together and be able to get through that first week, right, and then and beyond it. I would agree with that 100%. That was truly amazing. Now, this kind of for both of you, what is the communication like between you and like emergency systems and things like that?
Yeah, John Deming's my best friend. And worked with multiple emergency managers around the region. If I could pick on Frank over here, he actually called me one day and said, "Hey, we got an issue. We need to clear roads, but we don't know what lines that are entangled in the debris are live or not. You know, can you send a crew in to help us identify that?" Oh, hadn't thought about that. We make some calls internally and we're able to get a crew to help. So, and we did that then in Emmett and Sheboygan counties as well. So there's a lot of communication that takes place. I kind of look at myself as a go-between because I know nothing about the power grid, but they ask me the questions and I go find the answers. So I'll let you expand as well.
Yeah, mirroring on those points, I first want to say that we live in a very resilient community. We've been struck with 2 major disasters within the last 5 years, and being able to see our partners like E-Free and consumers come together and accomplish one goal is tremendous. So touching on that, we have stakeholder meetings every morning when we have full-scale EOC operations. So that brings all partners, not just consumers, but Great Lakes Energy into the picture as well. They will provide reports to us, and then we can kind of formulate a game plan going forward.
No, go ahead. Did you want to expand on? Well, I was going to say, what does this kind of emergency event look like for you guys over at the Otsego County Emergency Management?
Yeah, so early on in that week, excuse me, approximately Thursday, we started receiving notifications from the Weather Service and attended the Consumers Energy Emergency Briefing. We started to issue some public advisories, warning the public that they could expect extended outages, make sure their food supply is up to par and they have gasoline for generators. At that time, we had no idea that it was going to be this extensive. Friday, we went into what we call advisory mode. So we began to monitor the 911 calls coming in for the damages. And then later on that evening, we ended up declaring a full-scale local emergency declaration. So the way declarations work is once the county resources are depleted, we can declare a local county of emergency. Once that happens, then it gets pushed to the state level. The state then can determine if they're going to declare a local state of emergency and go into full-scale operation. This event involved 13 counties within our region. In the region, there's 17 counties in total. So everybody's resources were taxed, but with that full-scale EOC operation, it brought all the stakeholders into play and allowed us to accomplish a better response to the community.
Great. Now, how does emergency management secure community preparedness and citizens' preparation in an event of disasters like this in our community?
Yeah, so emergency management is a very dynamic field. As things advance, technology is a big one. When we first started with the EOC stuff, it was all paper forms. Now that's technologically done, and the state can actually see it as we're filling it out. Training is a huge component, so all of our emergency management staff attend trainings with local partners, communities, and then the state, Michigan State Police Emergency Management Division, to make sure that we're up to par with those standards and ensure that we're responding to the community as best that we can. Otsego County maintains 3 notification platforms. So Code Red, I'm sure you guys have heard, will issue public safety warnings and advisories through that platform. We also participate in the wireless emergency alert system. So even if you are not signed up to receive Code Red alerts, the wireless emergency alert system is federally mandated. So if you have a mobile device, you'll receive those alerts via that way. And then we are very active on social media as well, ensuring that we're getting that information disseminated.
Well, I want to say thank you again for everything that you guys did. I know, especially for EMS, you guys are going out on calls and trees are down and trying to get to folks and being there on the front lines to help those most vulnerable in our community. So thank you so much for getting us back up quickly, keeping us informed, and being that support that sometimes we don't think about until we need it. And so we just want to thank you very much. I'm going to turn it over to Dennis.
Thanks, Brian. I'm happy to introduce Lisa Marie Tobin from Gaylord Downtown Development Authority. Morning, Lisa.
Good morning.
Nice to see you. So we hear Downtown Development Authority. Obviously, when I think of that, there's been a lot of changes downtown over the years. Can you just walk us through what is the Downtown Development Authority?
So I brought this lovely light reading document with me that's about 50 plus pages for anybody that's really interested and has some time on their hands. The Downtown Development Authority has been around since 1985. Many people don't realize that. And it was established under the Public Act of 197 of 1975. And for many of you, 1985, some of you were just being born at that time. During that time, downtown communities were deteriorating. So a lot of growth was happening and expanding outward into more of our rural lands. And part of this problem with that is there was not a lot of attention being given to the downtown. And our downtowns really are the place for socio and economic connection. If you think about downtowns and what they do for our community, they are the face of our community. And for economic development, we really focus on promoting economic development, utilizing public funds to partner with private investment to really expand and grow our downtown. The really exciting thing is the Downtown Development Authority was established in 1985, and since then, many of you may or may not remember, on the corner of Center and Main, there used to be a parking lot, a dirt parking lot there. Alpenfest used to set up there. I remember as a child, they used to set up there. And now it's a beautiful bank that sits there. The pavilion is another thing that they've invested in. They've invested in the bathrooms downtown, and how that helps and promotes economic development is if you're downtown with a family and you need to use facilities, they will leave. So the whole idea is to really create our downtown and make it a place of connection. One thing that's really important about our downtown is it is a reflection of who we are. And people want to connect and experience who we are in our downtown. And unfortunately, we always, as a rural community, we fight against those rural stereotypes and of uneducated, not a place to visit. And Blight helps reinforce that. And so part of what the DDA does is to help ensure that we have a downtown that people want to experience and visit. And so we're moving forward with that. We've done a lot of great things over the years. And I'm really excited about the future of the DDA and where we're going with our downtown.
That's excellent. I've been here 20 years, and the changes I've seen myself over 20 years in downtown Gaylord is really nice. It looks incredible. And you mentioned Blight. If you've ever been to other downtowns, whether rural or larger, you do see Blight. And it's funny you mentioned that because I don't see it in our town. So it's looking great. Thank you so much. The Main Street program, what is that, and how does it work to benefit our community?
So the Main Street program is an initiative that started under the MEDC, and what it simply put is it's a strategic planning process at the community level. So if you've ever heard of the Balanced Scorecard, it's really the Balanced Scorecard applied to the community level, and it helps to keep you focused in 4 areas, but it's driven by the people of the community. So the 4 areas are economic vitality, the design of your community, the organization and how we get it done, and then also promotions, which is underneath that is our events that we take place. It allows the public and people from the community to sit on these committees and actually help drive the direction of what they want to see happen in their downtown. We're really excited. We've just got the program. We're at the engaged level, working with the state of Michigan. In addition to that, what the program also offers our community is it brings technical support and opportunity and opens up doors for grants that we can then utilize and apply for things in our community. So really excited about that.
That's wonderful. Well, downtown is certainly thriving, and it looks great. A lot of good things happening down there, so we appreciate all you do. Thank you so much. I'm going to pass it back to Ashley.
Thank you so much, Dennis. We are coming almost to the end of our program, but we have one final speaker this morning. I'd like to have a conversation with Chief Frank Clays, a name here in our community that a lot of people have heard. Our police department is so integral in our community, and Chief Clays, you've really been instrumental in kind of getting out and having a community forward-facing department. What are some non-traditional policing methods that you're doing within the community?
Well, thanks for having me. I love the opportunity to talk about all the good work that we do at the police department and with the city in general. I don't know that it's non-traditional, but it's probably our most popular thing that we have. Our K-9 program continues to be very active. The nice thing about this is one of three spots I'm going to talk about. All three are funded with the help of community partners. This program started up a few years back with the help of the People Fund, supplying some initial startup funding for us. And it continues to be very active. Zero is a great dog. He is a very good dog. All dogs are not created equal. He is a very strong narcotics and track and apprehension dog. I do try to share some stories from time to time. I do not share every bus that he gets on social media. It would get repetitive and probably not be the best look for us as a community. But he is a very active dog. Right now, we're seeing an uptick in kind of a changeover in narcotics. What had been heavily crystal meth, methamphetamine related issues lately has been transitioning to cocaine and crack cocaine. Some of that change that we've seen is we had crack cocaine issues 6-7 years ago. It was the predominant drug of choice. But when that was the case, it was coming into our community already in that crack form. We're seeing now where it's coming in that powder form, and they're actually chemically altering it into that crack form here in our community.
Why has that become so prevalent? Is it because we are transient or because of the financial aspect of it?
It is simple. It's simple math. The value has actually fallen out on crystal meth. So there's actually a larger profit margin in the cocaine. So that has become that prevalent drug. I mean, it seems funny to think that is what is driving it, but that is 100% what is driving it, is the value of crystal meth has fallen in the area and the value of cocaine has gone up. So to go with that, to try to combat that, obviously our officers on the road are a very big and active piece with that. But we also have a detective permanently assigned to the narcotics unit. Our narcotics unit is Straits Area Narcotics Enforcement. They are also very active, filled with a bunch of young, ambitious, good detectives doing good work. Actually, as we speak, they're in, I won't say where, but they're in one of those mid-Michigan cities right now. Our officer actively serving a search warrant on narcotics that are stemming from that area, that we actually have put the case together. We link up with their unit, and we'll go do that raid down in mid-Michigan.
How many counties are represented? I know when we talk about Straits Area Narcotics, a lot of people don't know what that is made up of. How many counties are represented on that task force?
Great point. It would be Otsego County, Emmett County, Sheboygan County, and Charlevoix County.
And I know that we see our officers out on the roads. Some of us see them more frequently than others. But we see them policing, doing traffic stops, different things like that. But you have officers placed in different positions that may not be visible always to the public eye, such as our school resource office or our human service. Tell us a little bit about both of those.
Yeah, they weren't traditional probably 10, 15 years ago, but now, you're seeing school resource officers pop up. We are fortunate enough to have a great partnership with Gaylord Community Schools, and that we have 2 that we supply to them. A lot of people don't know, our school district here has been forward thinking on security for a very long time. They were far, going back 15 years ago, they were far ahead of most public schools in the state with investing in measures that make us safer or keep our citizens, or our students rather, safer. They've made sizable investments. They continue to make that sizable investment in partnering with us for that school resource officer piece. They continue when I reach out to them for products or technology that again advances that shared cause. They continue to come through and help us with funding on that. It's a tremendous thing that they're doing for the community and helping us do what we're tasked to do already, which is keep our community safe.
And I know we had talked about that human resource position last year and that officer, but he's officially come into play and that funding came through. So tell us what that looks like with him.
Yeah, again, that funding was collaborative. And what I liked about that funding is it came from a bunch of smaller but sizable donors. And I like that because it shows how many people recognize it as a powerful positive to the community. What the position is, if you don't know, it is like a social services coordinator. We recognize that we kind of are the emergent tip of the spear for social service need. We're people don't realize the police department's role as that community caretaker. And we're the only 24/7, 365 community caretaker. So at times our officers historically have tried to figure out what they're going to do with a homeless person with no place to go in January at 3 o'clock in the morning. And a lot of the times there's not even someone to call. So it leaves, our officers to their own devices at times to figure that out. So with this program, we've tried keeping our officers up to speed on all of the tremendous social service network that we have that's available. But that's kind of an ever-changing dynamic where some programs are available today and they exceed their funding and tomorrow they're not. So it's difficult to keep all of those officers on that same page, where this one officer is totally dedicated to that mission, to that role. The officer interacts with both the public from an emergency side, and they get referrals from the PD. So when we have that contact, maybe at 2 o'clock in the morning on we'll say a domestic violence call, and our officers recognize there's children in the home and there's food instability, they can make that referral to this human services officer, and he can follow back up and try to address some of those. Some of the things he's doing is he has the paperwork for Department of Health and Human Services. So he is in a position to actually help somebody who might have some educational barriers or some physical barriers, complete that paperwork, submit that to Department of Health and Human Services. As police officers, we're used to working out in that environment, and we're very used to a fluid situation. An example, he just doesn't take no for an answer kind of on things, is kind of how we all operate. And a lot of the times an example of a barrier would be transportation. People don't think of that being a transportation as being a huge barrier. We might have somebody at Otsego Memorial that is in need of transportation to maybe like a substance use facility, and that becomes the obstacle, and it eats up a bed and adds to those wait times that they were just talking about. solely because we can't arrange transportation over there. With this position, it allows us, if that's the only barrier, it allows us to have a police officer who's used to dealing with folks that are in mental health or substance use crisis. We're used to dealing with that. And we have the things in place to transport people. We have body cameras. So if it's a male officer transporting a female person in crisis, sometimes that's a huge obstacle for a traditional style social worker. But we have body cameras, we have in-car cameras, we have the ability to safely and professionally do those things. So he is already, in the first several months, broke down a lot of barriers. He's done a lot of good beyond the measurable good, if you would. I know the slide behind me shows him with a gentleman with a guitar. He's not starting a band or anything like that. I think we're going to do that year 2. But what he's actually doing there in that photo was that gentleman, Taylor, our officer, had cause to get involved with that gentleman. And in getting involved with him and helping him through an issue or two, he learned that that gentleman had, he kind of relied heavy on music to help him therapeutically. But his father, who had died a few months back, needed a wheelchair. So he sold his guitar and his bass to supply his father that medical equipment. So Taylor, talking in another meeting session, because he interacts with our social services network, somebody who wished to remain anonymous heard that story, was moved, and they supplied that gentleman a bass and an amp. And because he lives in an apartment, and more importantly to me, some headphones, so I'm not getting disturbing the peace calls. They supplied that, Taylor delivered that, and it's just a great example of things that there's just no other way to tie all that together besides having that social worker piece in that front, really front line.
I know that you're going to age of technology when you talk about collaboration and all of those different things. What is a way that the police department has collaborated with other organizations in our community and use technology, or you share technology to kind of help the department and put them on the front edge of this being a small community?
Yeah, one of the things that we just have acquired in the last year through a grant was, I'm sure you've seen it, it's not subtle. We have a very large tower that is riddled with cameras. It is not to spy on anyone. It is purely a peacekeeping device, you know. It's amazing how polite everyone gets when they know they're being recorded from 20 angles. So it is actually a great piece of technology. We can send it up manned or unmanned. Our officers can monitor the cameras from the ground. I can monitor the cameras from anywhere, you know, that I have, you know, they're wireless. You know, we can see that signal. The cameras are pretty impressive. They have the ability, if you're not anticipating, we'll take Elpenfest, for example. If you're not anticipating any people there after midnight, you can set those cameras to send an alert to you if that's what you want to do. If they detect motion, you can set them to track the person, zoom in, track the person, and follow them. So they're definitely a force multiplier with that tower. And truthfully, we've heard a couple of, we feel a little spied on, but for the most part, people are pretty receptive to it. You know, we've used it at a few protests, and kind of both teams of the protesters have said, hey, it's been great to have around. It's cut down on any kind of counter-protest problems, you know. Everybody knows that, you know, they should be polite, I guess, when you're being recorded. To go along with that technology piece, last year, I was talking about purchasing license plate readers for inside our patrol cars. We just entered into an agreement to add some pole cameras with a company called Flock. They are license plate readers, or stationary license plate readers that will work in tandem with our license plate readers in our car. And that piece of technology has directly benefited us. For example, we had an attempted murder not too long ago. That subject was located in Kansas. And we were getting notifications through that flock system of where he was at. We're like, he's on the western side of Illinois, he's moved into Kansas, and he was eventually apprehended because of that fact. With the poll cameras that we are going to have out in the spring, we would have known that that suspect had left town, or at least his vehicle did. And we could have got that word out faster to communities to the south of us to watch for that. We would know which side of town they left out of. So we could, if they left to the west, we'd let that 131 side know more. If they left to the south, we would let that, 75 corridor know.
Now, I know we talked about that department and all the different developments and changes, but as a lot of people may not know, in your spare time, you decided to become an integral part of the fire department, and you've headed up fire for here in Otsego County. So can you give us an update, kind of what things look like there? I know you have a teach and play, so just kind of let us know where we're at with that fire department.
We do. In the last year and a half, our fire department has undergone a giant transformation. We formed as a fire authority, which allows us some revenue generating, and it kind of serves as its own governmental entity, something like the road commission would be. Our fire authority encompasses 5 townships, 4.5 townships in the city. It would be Dover, part of Chester, Bagley, Livingston, Hayes, in the city. We've transitioned from a volunteer fire department to a part-time paid on-call, which is, comes with a bunch of changes. We did hire our first full-time fire chief, Todd Troxel. He comes to us from Petoskey Public Safety. So him and I kind of share that law enforcement background, but he's crazy enough to go into burning buildings, and I try to avoid that. It's also forming that entity has allowed us to play catch up. As a community, we really had not raised the funding we were capturing for the fire department in a long time, 8 or 10 years at least. And we were doing something when we needed a piece of equipment, we would go to the taxpayers and put it to a vote. Where this allows us to capture $1 million, and in capturing that $1 million, we're able to set an operating budget and then to long-term plan for some of those things that we're playing catch up on now. Behind me, you'll see a picture of a fire truck that's actually Ann Arbor's, but we are going to get one identical basically except for color scheme. That fire truck is $1.5 million. I checked, it was not Canadian either, it's US dollars, and I thought that was crazy as a chief of police, but that's what they go for. So we have that should arrive at the end of the month. The alien looking unit next to it is an SCBA. They tell me that's so you can breathe in a burning building, right, Gavin? Really important if you're a firefighter. They were on some very outdated equipment that wasn't even serviceable because the company they don't make equipment anymore. So replacing that, 25 of those units is $300,000 almost. So those actually should arrive any day as well. To go along with that, we recognize that with the ice storm, we've had some, or we're going to anticipate having some new challenges. We are structure fires. We really don't, the forest fire piece is the DNR, but we run into it sometimes even in our rural settings with getting access to outbuildings and that sort of thing, that it can be difficult to get a full-size fire truck to. And with this piece of equipment behind me, we purchased a truck and what they call a skid unit, which carries a couple hundred gallons of water. It is intended for woodland firefighting, but it also, again, can get a couple hundred gallons of water to a problem that we might not be able to get that $1.5 million truck down just because of the narrow nature of it, and it's quite a heavy piece of equipment. Anticipating the potential for forest fires with all the debris down. It would be nice to stop it when it's a lot fire as opposed to a forest fire, and that would let our fire department help kind of tackle that problem before it turned into the bigger problem, ideally. To go along with those changes, their training is improving. They're training all the time. Last week, it still might be up. It looked like Shantytown over there with all their pallets and that they had up and running. They're working on redoing an old fire truck that has been in the city and the fire department's possession for 50, 60 years. Yeah, they're doing a lot of good things over there.
So, kind of finish our program today, Chief places the only presenter I think brave enough to be willing to go on fire again. So if you have any questions, I know this is a hot topic in the presenter, but a lot of times people get questions about things happening in the department, and it's not always an easy access to kind of get answers on those things. Do we have any of those? You talk long enough to cover.
I guess.
Awesome. Well, I want to thank everybody just so much for being out here today and really being a part of this State of the Community. In the last few years, we've kind of changed the format of this, and I hope that it's giving you the opportunity to really hear from different entities within our community. You see some fresh new faces up here today, something that you saw last year you won't see again. We as a chamber are really trying to keep this a fluid event and really hear every year from different new sectors in our community, so you feel completely informed and walking through your day and knowing about your community, building your businesses successfully here. We do have a few things I want to say to you this morning. We've had our Fuel Up partners this morning with Family Fair. Gaylord Free Church has also so generously welcomed us into their facilities every year and made this event possible. Chemical water systems and food stuff. So I'd like to